Welcome. We are excited to provide this session, Disability as Diversity, Impact on Patients and Fellow Providers. This program is designed to increase your understanding of how physicians and physicians in training living with disabilities contribute to diversity, impact patient care, and influence colleagues. By the end of this session, we hope you will be able to compare the prevalence of disability in the United States to the known prevalence of physicians with disabilities in medicine, identify several examples of how the presence of clinicians with disabilities can positively impact patient care, and name several ways clinicians with disabilities can positively impact colleagues and practice environments. Disability encompasses many diagnoses and experiences. Some disabilities are non-apparent, such as generalized anxiety or mild traumatic brain injury, while others are more apparent, such as using a wheelchair or having a limb difference. New research suggests that about 26.8% of adults in the United States live with a disability. However, that representation is not paralleled in the physician population. The latest research on the prevalence of medical students with disabilities suggests that only 5.8% of medical students disclose disability. For resident physicians, this number is a bit higher at approximately 9.3%, but declines sharply for attending physicians at 3.1%. While these numbers have grown over the past decade, physicians with disabilities remain underrepresented in medicine. Research suggests that physician diversity may have positive effects on patient care and increase healthcare access for marginalized groups. In particular, having racial or gender concordance with a provider can increase trust, communication, and satisfaction, while also increasing compliance with routine screenings, medications, and follow-up. Similarly, it is believed that physicians with disabilities can positively impact patient care and the patient-physician relationship, as well as reduce health disparities for patients with disabilities. Not only is it powerful for a disabled patient to have a doctor with a disability, but doctors with disabilities can shift medical culture away from ableist assumptions, encouraging all providers to provide disability-conscious care.
Dr. Lopez will be in shortly.
Hi, I'm Dr. Lopez. I will be your doctor today.
Physicians with disabilities can help challenge stereotypes about patients with disabilities, who are often perceived as helpless, limited, burdensome, or perhaps even perceived to be faking their disability.
Wow, she has a wheelchair, just like me.
Many of these perceptions persist because people with disabilities experience structural barriers that prevent both access and accommodation, creating a negative experience for the individual and framing disability as a barrier for those around them.
Wow, I never thought Abby could be a doctor.
However, when environments are accessible by being welcoming, adaptive, and responsive, individuals with disabilities can enjoy the same experiences as their counterparts without disabilities, showing that, in reality, the issue is lack of access rather than disability itself.
Great to see you, Abby. Physical therapy is at 2. You have lots of time to get there.
Researchers believe that physicians with disabilities, informed by their lived experience, may be better prepared to care for disabled patients and may be more empathetic in their approach.
Thank you for thinking of our needs. That helps a lot.
Can't wait to see you next time.
Studies show that medical students with disabilities have greater empathy and may become more empathetic physicians because of their lived experience of disability. They are also more likely to match into primary care, and many express a desire to provide concordant care, improving the healthcare experience for patients with similar medical needs.
I want to grow up to be a doctor like Dr. Lopez.
You sure have made an impression on Abby. Your ability to connect with patients has impressed me throughout your residency here, Dr. Lopez.
Not only does having providers with disabilities potentially lead to more culturally competent care, but the presence of equal status relationships can actively transform normative culture and attitudes, changing the way all providers view disability and enhancing the ability of physicians to provide effective medical care to patients with disabilities. Insightful providers can also educate colleagues about expanding accessibility and improving practice habits, such as arranging multiple appointments on the same day to facilitate access and reduce the burden of multiple visits.
We would like to offer you a position in our practice. Would you like to take a tour of our facility?
That sounds great!
Both patients and providers with disabilities experience barriers to healthcare, including inaccessible clinical spaces. Increased exposure to peers with disabilities in medicine can increase awareness of barriers to accessibility for their colleagues. An increased awareness of these barriers can lead to improved accessibility in patient care spaces, benefiting all, patients and providers alike. For example, trainees with mobility needs have heightened awareness of the importance of accessible scales, widened doorways and hallways, adjustable exam and operating tables, and automatic door openers. This awareness can be shared with colleagues, allowing each provider to advocate for patients.
Exam tables that raise and lower would help patients and allow me to better examine them. It also ensures that a number of patients can utilize the exam table without difficulty.
While the value of doctors with disabilities is clear, simply welcoming them to practice is not enough. A space must be accessible, physically and culturally, for a provider to bring their full value.
Wow, I never thought about this.
Building institutional support for physicians and trainees with disabilities comes from recognizing that they offer more than just the skill set of their chosen specialty. The experience of having a disability, regardless of visibility, can have a positive impact on patient care.
I can't breathe. I'm so scared.
Hi, Miss Jones. My name is Max. I use these breathing exercises when I get anxious about things in my life that really help. Would you want to try them with me and see if it can help you?
Having a disability can shape rapport building with patients and provide a positive framework for disability and chronic illness. Physicians and trainees with disabilities may also be able to use personal experiences to help patients cope with illness and disability in affirming ways, in contrast to the medical model that often frames disability as deficit.
That was great. I would have never thought of that.
It also opens doors for future trainees with disabilities.
He did an excellent job. We should find more surgeons who can connect with our patients like that.
Furthermore, contact theory suggests that colleagues may develop higher expectations of individuals with disabilities by interacting with peers with disabilities in equal status relationships. This may extend to the expectations of their patients. Ultimately, by recognizing disability as an underrepresented identity in medicine and dedicating effort to recruitment, accommodation, and retention of trainees with disabilities, your institution has an opportunity to increase positive modeling for patients and colleagues, expand accessibility, foster empathy, and improve patient care. Information referenced in this video comes from the following resources. This video is a product of the Doctors with Disabilities Initiative's DIGME, or Disability in Graduate Medical Education program, and the Center for a Diverse Healthcare Workforce at the University of California, Davis School of Medicine. Additional resources and information about the Docs with Disabilities Initiative can be found on our website at www.DocsWithDisabilities.org and on the Docs with Disabilities Initiative YouTube page. We also invite you to follow us on Twitter and Instagram for updates on our work.